Before March 16th, the local narration in the community was, okay, so this is some disease in Asia, or this is some disease in Seattle, and everything was normal. I mean, people were not taking anything seriously. If you remember in pandemic, one of the biggest thing is identifying a positive individual and quarantine, because that's the only way we can control this spread. And what was happening till that time was we would collect these samples and we would send out to a reference lab, and it would take us 7 to 10 days to get the results back. We were actually the first lab in the southeastern United States to start testing in-house. And I still remember it was 1 a.m. on March 16, we found the first positive patient in the region. Suddenly, everything was changed.
A key principle in disaster preparedness in emerging infectious diseases is early awareness. You always make better decisions when you're making them in a deliberate fashion in advance, rather than having to make a decision in the heat of the moment. Because we got an early start, that allowed us to think through things like drive-up testing before we actually had to do it, and do that in a very deliberate fashion.
In regular term, getting an FDA approval takes army of people, tons of money, and the process is usually 6 to 8 months long. And within 2 weeks, we put together a plan. We validated what we need to do and submitted to FDA, asking the permission to test. We got the letter back from FDA at 6 p.m. and we started testing at 11 p.m. Within a few hours, we were able to identify a positive patient.
Once we had our first case, we had to take everybody off the conventional infectious disease services, and we had to develop a COVID service. And the reason for that is because it increased so rapidly. All the studies that we were doing for bacteria and fungi stopped, and we started doing studies on COVID patients.
We actually run on about 4 different testing platforms. And so the complexities of all the different laboratory professionals that really had to fill in the gaps and support each other is just really notable.
Having that first patient diagnosed with COVID in the lab not only helped us to put on the map that we can do this, but it also helped the community realize that this is not a disease, something which is happening in the east or west. This is right here in Georgia, right here in Augusta, and that has helped us to contain the disease to begin with.
When we were testing hundreds of patients a day, many others in the state were struggling to do 25 to 50 a day. And that attracted the attention of the governor's office and the Georgia National Guard. When they came to observe our testing site, they were like, we need to replicate this throughout the state.
We could get results within 2 to 3 hours. But the challenge was the capacity. Each and everything in the lab which we use is being manufactured in China. And the Chinese government basically stopped exporting that stuff to the United States. We didn't have nasopharyngeal swabs. We didn't have the media in which we collect the swab. We didn't have the PCR instruments to do the testing. We didn't have the reagents to do the testing. So all these things we sat together and we identified what we can make locally. We realized the nasopharyngeal swab is going to be a really challenging sample type. So we started a major study in April, and then we collected a nasopharyngeal swab and saliva from the same individuals, 500 or 600 of them. And then we did rigorous research from April, May, June, 3 months to show 100% concordance. The individuals who had virus in the nasal swab, those individuals have virus in the saliva. We were able to put all the data together. We started offering saliva as a test to the CSRA and the local region. I think we've done more than 150,000 tests for the state and the region, and I think we still are around 4 or 5 labs in the country which offer saliva as a sample type.
This team has pulled together in ways that you really just can't imagine. If they had not done their job just absolutely stellar, it would have fallen apart. but every piece of the system worked together and everybody did their job to the best of their abilities and in a world-class fashion to really just create a fantastic response to fight this disease.
There comes a time in every individual's life when, in a cliche moment, you say that I'm going to do something which is going to help millions of people. And this was our moment.